Imagine walking into a hospital for outpatient surgery. You're there to get fixed and go home. You're expecting anesthesia for pain management and sedation. You also expect the medical team taking care of you to have systems in place to make sure that the medication going inside your body is the correct medication and proper dosage. Except it isn't. When people do the most, I do the analysis. Let's go. Today, we're talking about a serious medication error at Ascension St. Thomas Hospital, Midtown in Nashville, Tennessee. But I don't just want to talk about a medication error today. I want to talk about the system surrounding that error. Because how does one mistake make it all the way through a hospital and reach 4 different patients? And more importantly, who was supposed to catch it?
4 people expecting routine surgeries at this Tennessee hospital are now facing a medical nightmare. A drug mix-up at Ascension St. Thomas Midtown Hospital in Nashville reportedly left 2 patients paralyzed and at least 1 other on a ventilator after officials say they were given the wrong medication prior to surgery. Now, those 4 patients were reportedly given potassium instead of an anesthetic.
4 patients who were undergoing joint replacement surgeries were given potassium by mistake instead of the intended anesthetic medication called bupivacaine. Bupivacaine is used in surgeries to give patients a calm sedation. It makes the patient groggy or counter out of it, throughout the medical procedure, but not necessarily asleep. The Ascension Hospital has confirmed that the medication error occurred in its own hospital pharmacy, and it says that all 4 patients experienced adverse health reactions, and they had to receive immediate medical care.
Now, those 4 patients were reportedly given potassium instead of an anesthetic. The family of one of those patients told our CBS affiliate in Nashville the mix-up happened inside the hospital's pharmacy. Now, hospital staff apparently realized something was terribly wrong when multiple patients went into cardiac arrest. Too much potassium given too quickly can stop a person's heart.
One of those patients is 72-year-old Glenda Dorton. Her family says that she was left paralyzed following what was supposed to be a routine knee replacement surgery. Another patient's family has said that she remained on a ventilator, and while the hospital hasn't publicly released the full details of the patients, we do know this much. There were 4 patients who were harmed by the same medication error. And that raises the issue to a much more broader aspect than just who messed up. We're talking about an entire healthcare system that's supposed to have multiple safety precautions in place, or I should say barriers, between a medication being prepared and that exact same medication reaching a patient. So let's spend a couple minutes to discuss the barriers.
Now, in a statement, the hospital said they were, quote, deeply sorry for the harm caused and had implemented corrective safeguards to prevent something like this from happening again. And we know the Tennessee Bureau of Investigations is now looking into this mix-up, but there are still a lot of unanswered questions. The hospital has also not made it clear what those safety protocols now include.
There's something called the 3 checks that's taught in medication administration. The basic idea is that you don't just look at a medication once and assume that is correct. You check it multiple times. The exact workflow might vary by hospitals and medications, but the 3 checks involve comparing the medication against the order, and there are essentially 3 different checkpoints that an anesthesiologist should follow: when you obtain it, while you're preparing it, and immediately before you administer it. And why? Because healthcare systems understand that people make mistakes. Doctors make mistakes. Nurses, pharmacists, technicians, people in the medical field make mistakes. And these medical professionals get distracted too. They get tired, they grab the wrong thing. But in medical practice, there's simply no room for an oops or my bad from one individual while everything surrounding that action goes left. And that's exactly why medication safety can't depend on one person being perfect. There are no perfect people. The system is supposed to provide layers of protection. The first check happens when the medication is obtained. The question is essentially this: is this the medication that was ordered? You're comparing the medication with the order and making sure that you're dealing with the correct drug. Now, in this Nashville case, we know from the hospital's own statement that the medication error occurred inside the hospital's pharmacy. So that's important to remember because the wrong medication wasn't just discovered at the patient's bedside. No, the hospital said that the pharmacy itself prepared the wrong medication, which means we're looking at a failure somewhere up the chain. We don't know which individual performed which check or precisely where the pharmacy workflow broke down. There's an active investigation taking place to figure that out. The second check happens while the medication is being prepared. And this one's especially relevant to this story because this is where they'd be asking, am I preparing the correct medication for this patient? If you're preparing a syringe, you're supposed to be putting one medication into that syringe. But if the wrong medication is picked up, this is another opportunity for somebody or some process to catch the mistake. And what makes this story particularly interesting is that the hospital has now implemented independent dual verification for spinal medication workflows. And that means that a second trained pharmacist now has to perform a final visual and physical check before the medication leaves the pharmacy. Think about what that says. The hospital is adding another human verification layer after this incident. And that naturally raises the question, what verification was in place before the incident? Again, that's not me saying that a particular employee failed to do their job. We don't know that yet. The investigators are going to determine it though. But if you're looking at this from a patient safety perspective, that's a reasonable question that the public needs an answer to. And then there's the third check. The medication is checked again immediately before being administered by the anesthesiologist. This is the final opportunity to say, wait, this is not right. Then you run down the list. Okay, right medication, right patient, right dose, right route, right time. And that's a critical step because once that medication enters the patient, we're no longer talking about a paperwork error. We're talking about a medication that can potentially cause real physical harm. And in this case, that's exactly what happened. How did the wrong medication get from the pharmacy? How did it get through the hospital's medication process and ultimately into the patient's body?
Hi, I'm a hospital pharmacist, and I just wanted to give my insight on how terribly egregious that medication error was that occurred at the Tennessee hospital. So if you haven't seen the news story yet, there was a mix-up in the pharmacy, and at least 4 patients were given potassium instead of bupivacaine prior to surgical procedures. There were multiple cardiac arrests. 2 of the patients ended up paralyzed. One of them was on a ventilator. Just really, really bad. So how you mix up potassium, which begins with a P, and bupivacaine, which begins with a B, is beyond me. When things are prepared in a pharmacy, so this was meant to be injected, so it would have been done in a sterile environment, probably in a clean room. A pharmacist would have had to verify this after it was done. So it might have been a technician who made it, but a pharmacist still would have needed to verify the final product. So they would have needed to see all the vials and the equipment that was used to verify that it was correct. So if that's the case, either someone bypassed that step and just signed off on it, which is, I would say, criminally negligent, or someone just saw a vial and didn't even read what was on the vial, which potassium and bupivacaine, the vials look very, very different. So why this was so incredibly dangerous is that potassium has to be given slowly, so you can't give more than 10, maybe 20 milliequivalents of potassium per hour. If you inject potassium quickly, it can stop your heart. As a matter of fact, potassium is the final drug in a lethal injection cocktail.
We're talking one mistake and 4 patients. 4. If one person makes a medication mistake, it's easy for people to immediately say that person made the error. But when the same medication affects 4 different patients, then the conversation changes because now we're not only asking about the initial mistake, we're asking about the system surrounding the mistake.
So if a prisoner is being given the death penalty by lethal injection, there's typically 3 drugs given, and the third one is potassium, a large dose of potassium to stop the heart. So possibly multiple people messed up really, really bad here, but someone's definitely going to lose their license. Someone probably should go to jail, because whether this was horribly negligent or possibly this was intentional, this is beyond a normal medication error.
One of the patients is 72-year-old Glenda Dorton. She suffered paralysis and required ventilator support. And that's where this story becomes especially difficult to process, because these weren't patients coming into the hospital for something unusual or some experimental type surgery. They were there for a routine surgery, a knee replacement, outpatient surgery. They trusted the hospital to get the basics right, and they should be able to do that. And that's why medication safety systems exist in the first place. If there were safety checks, why didn't they stop the error before it reached the patients? We need answers.
In today's statement, the hospital confirms that the medication error happened in the hospital's pharmacy. Instead of receiving an injection of a common anesthetic in their spines, the 4 patients each received potassium phosphate. The hospital says the patients, quote, experienced adverse health reactions and received immediate medical care. News Channel 5 investigators learned from 2 of the families that one patient, Glenda Dorton from Centerville, was left paralyzed, while a woman from here in Nashville was at last word on a ventilator. Ascension St. Thomas also said in its statement that it has made several changes to its pharmacy and safety protocols to prevent this type of mistake from happening again. The hospital also says it brought in outside experts to review and validate its correction plans.
After identifying the error, Ascension St. Thomas says that it now has implemented additional safeguards, and those include isolated medication storage for high alert medications, mandatory hard stop and escalation procedures for spinal medication scan alerts, an independent dual verification by a second trained pharmacist before spinal medications leave the pharmacy. That's significant because it's more than just reminding everyone to be more careful. These are additional barriers designed to make it harder for the same type of mistake to ever happen again. Because human error is not the whole story. Sometimes we talk about medical mistakes as if the solution is as simple as don't make mistakes. If only that was the case. Humans are going to make mistakes. The goal of a safety system is not necessarily to create a world where mistakes never happen. The goal is to create a system where a mistake won't automatically become a catastrophe. Think about an airplane. Pilots can make mistakes and air traffic controllers can make mistakes. Mechanical components of that plane can fail, and that's why aviation uses multiple layers of safety. I believe healthcare has to think of it that same way. If someone selects the wrong medication, there should be another opportunity to catch it. If the first check misses it, another check should catch it. If the second check misses it, another safeguard should catch it. But the patient should not be the final safety barrier. Because if the wrong medication reached one patient, that's already serious enough. But when 4 patients are affected by the same medication error, it raises questions about whether the problem was bigger than a single moment.
4 patients were injected with the wrong medicine. One woman told Only News 2 her mother-in-law was supposed to get an injection into her spine for anesthesia, but was given a potassium injection instead.
It was supposed to be the anesthetic. It was supposed to be bupivacaine, and it was potassium, and we don't know what quantity.
News 2 met with experts in anesthesiology Wednesday. The study says the patient was supposed to get a spinal injection of bupivacaine, but instead was given potassium chloride. When we asked why, anesthesiologists showed News 2 how similar the glass ampules look of the two medicines, and say if a doctor or pharmacist did not properly read the label, they could easily be mixed up. But
this is life-changing. You know, you don't come out of this without some type of life-altering catastrophic deficit.
We don't know if there's a common workflow issue, a common medication preparation process, or storage or labeling even. We don't know if this was a verification problem, a technology problem, or a training issue. And I don't want to pretend that we know. But we do know that state authorities and the Tennessee Bureau of Investigation is looking into the incident. And there's a lot of unanswered questions still. And this is where I want to separate accountability from blame, because the easiest thing in the world to do is to find one person and say, that's who caused it. But if investigators discover that a system allowed the error to happen, then simply punishing one individual is not going to fix the problem, because another employee is going to come along and they could make the same mistake tomorrow. And if the system hasn't changed, the outcome won't either. Patients should never have to be the one to catch the error. That's what bothers me most about this. When you're the patient, you're completely vulnerable. You're laying down on an operating table, either sedated or unconscious, and you may not know which medication you were even supposed to be receiving in the first place. You can't just look at a syringe and say, wait a minute, that don't look like bupivacaine. Come on. That's not your job. The patient is supposed to be protected by the system. So who was supposed to catch this? We still don't know exactly who was supposed to catch it. And that's why it's important to allow the investigation to tell us exactly what happened. We already know that one medication error has reached 4 different patients. We can't just look at one person either, because the purpose of the 3 checks is to create multiple opportunities to stop a single error. And when an error gets through multiple layers of a healthcare system, that's when we have to ask if the system itself needs to be examined. People make mistakes. That's human. But patients shouldn't have to pay the price for a mistake that multiple safety systems were designed to catch. And that's why this story is more than about potassium versus an anesthetic. It's about the layers of protection that are supposed to stand between a human error and a human patient. If you enjoyed this video, please give it a thumbs up and share it with someone who can use this message. Subscribe to the channel if you haven't already done so, and leave me a comment down below letting me know your thoughts. Do you see this as an individual medication error, or does the fact that 4 patients were affected point to a much larger system failure? Meet me in the comments. We can continue the conversation there.